Bipolar disorder is a complex mental health condition that significantly affects mood, energy, and behavior. Individuals with bipolar disorder experience traumatic shifts in mood that include emotional highs, known as mania or hypomania, and emotional lows, known as depression. During the high or manic episodes, individuals may feel euphoric, full of energy, and capable of achieving anything. They might talk faster, sleep less, and engage in risky behaviors. On the flip side, depressive episodes bring feelings of hopelessness, sadness, and lack of interest in activities they once enjoyed. These shifts between mania and depression are more severe than the usual ups and downs that everyone experiences from time to time, and they are also often unpredictable. So, they can significantly affect sleep, energy levels, decision making, and the ability to think clearly. The prevalence of bipolar disorder is notable, affecting approximately 1% to 2% of the global population. Some estimates suggest that about 46 million people live with this condition globally. It typically begins in late adolescence or early adulthood, though it can also emerge in childhood or later in life. Both men and women are equally likely to develop the condition, although some studies suggest that women may experience more depressive episodes and men may experience more manic episodes. Types of bipolar disorder. Bipolar disorder is divided into several types based on the pattern and severity of mood episodes. Number 1. Bipolar 1 disorder. This is often considered the most severe form of bipolar disorder. The hallmark of bipolar 1 is the presence of at least one manic episode that lasts at least 7 days or by manic symptoms, so severe that immediate hospital care is required. While not required for diagnosis, most people with bipolar 1 also experience major depressive episodes. These depressive periods typically last at least 2 weeks. Mixed episodes featuring both manic and depressive symptoms can also occur. Number 2. Bipolar 2 disorder. This type is characterized by a pattern of depressive episodes and hypomanic episodes. Hypomania is a milder form of mania. It's still an elevated mood state, but it's less severe than full mania and doesn't cause the same level of impairment. People experiencing hypomania might feel more energetic, productive, and creative. However, these episodes don't last as long as manic episodes and don't lead to the severe problems in daily functioning that mania can cause. Here, the depressive episodes are typically more frequent and longer lasting than the hypomanic episodes. Number 3. Cyclothymic disorder or cyclothymia. This is sometimes described as a milder form of bipolar disorder. People with cyclothymia experience numerous periods of hypomanic symptoms and depressive symptoms over at least 2 years, 1 year in children and adolescents. However, these symptoms don't meet the full criteria for hypomanic or major depressive episodes. The mood swings in cyclothymia are less severe than in bipolar 1 or 2, but they can still significantly impact a person's life. Number 4. Other specified and unspecified bipolar and related disorders. These categories are used when a person has symptoms of bipolar disorder that don't fit neatly into the other categories. For example, someone might have periods of hypomania that last only a few days, or they might have depressive episodes with some manic symptoms that don't quite reach the threshold for hypomania. Causes of bipolar disorder. The causes of bipolar disorder are complex and not fully understood. Research suggests a combination of factors contribute to its development. Genetics play a significant role. If you have a close relative with bipolar disorder, your risk of developing it increases. However, genes aren't the whole story. Environmental factors, life events, and brain structure also contribute. Stressful life events, such as the death of a loved one, divorce, or job loss, can trigger episodes in people predisposed to the condition. Childhood trauma or abuse may also increase the risk. Additionally, the condition is also associated with imbalances in certain neurotransmitters, such as serotonin, dopamine, and norepinephrine, which are chemicals in the brain that regulate mood. These imbalances can affect how the brain processes emotions, leading to the extreme mood swings seen in bipolar disorder. Brain structure and function differences have been observed in people with bipolar disorder. Some studies show changes in the size or activity of certain brain regions involved in emotion regulation and decision making. However, it's unclear whether these changes cause bipolar disorder or result from it. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of bipolar disorder. The symptoms of bipolar disorder vary widely depending on whether an individual is experiencing a manic, hypomanic, or depressive episode. Number 1. Manic symptoms. During manic episodes, people often feel on top of the world. They might start multiple projects, make grandiose plans, or engage in impulsive behaviors like excessive spending, reckless driving, or risky sexual encounters. The normal filters and inhibitions seem to disappear, leading to actions that can have serious consequences. Their thoughts race, and they may speak rapidly, jumping from one topic to another. Sleep becomes less important, and they might feel they can go for days with little rest while still feeling energized. In severe cases, mania can lead to psychosis, where a person loses touch with reality, experiencing hallucinations or delusions. For example, someone might believe they have special powers or are a famous historical figure. Number 2. Hypomanic symptoms. Hypomania, seen in bipolar II disorder, involves similar symptoms, but to a lesser degree. People experiencing hypomania might feel more productive and creative. They're often more sociable and talkative than usual. While these symptoms can feel good, they're still a deviation from the person's normal state and can lead to problems if left unchecked. Number 3. Depressive symptoms. Depressive episodes bring the opposite experience. People feel deeply sad, hopeless, and worthless. They might struggle to get out of bed, lose interest in activities they once enjoyed, and have difficulty concentrating. Some people describe depression as feeling like they're moving through molasses or carrying a heavy weight on their shoulders. People often experience fatigue that sleep doesn't seem to cure. They might sleep excessively or have trouble sleeping at all. Appetite changes are common too, either eating much more or much less than usual. In severe cases, depression can lead to thoughts of death or suicide. These thoughts are a serious symptom that requires immediate attention and intervention. Mixed episodes, where symptoms of both mania and depression occur simultaneously, can be particularly distressing. For example, an individual may feel a combination of sadness and hopelessness along with agitation, irritability, and high energy. These episodes can be confusing and increase the risk of suicide. Diagnosis of bipolar disorder. Diagnosing bipolar disorder can be challenging, as it often mimics other mental health conditions. However, it typically begins with a comprehensive evaluation by a mental health professional. This includes a detailed medical history, family history, and a thorough discussion of symptoms. One of the key challenges in diagnosis is that people often seek help during depressive episodes but may not report manic symptoms. This can lead to misdiagnosis as major depression. It's crucial for healthcare providers to ask about past periods of elevated mood or energy. Mood charting, where individuals track their moods, sleep patterns, and life events over time, can be a valuable diagnostic tool. This helps identify patterns and cyclical nature of mood changes characteristic of bipolar disorder. Physical exams and laboratory tests may be conducted to rule out other medical conditions that could cause mood symptoms, such as thyroid disorders or neurological issues. Psychological assessments and questionnaires can also help in the diagnostic process. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, provides specific criteria for diagnosing different types of bipolar disorder. For example, a diagnosis of bipolar I disorder requires at least one manic episode, while bipolar II disorder requires at least one hypomanic episode and one major depressive episode. Treatment for bipolar disorder. Treatment for bipolar disorder typically involves a combination of medication, psychotherapy, and lifestyle changes. The goal is to stabilize mood, reduce the frequency and severity of episodes, and improve overall quality of life. Medications play a crucial role in managing bipolar disorder. Mood stabilizers, such as lithium or valproic acid, are often the first-line treatment. These medications help prevent manic and depressive episodes and can reduce the risk of suicide. Anticonvulsants, originally developed to treat epilepsy, are also sometimes used as mood stabilizers in bipolar disorder. Antipsychotic medications may be prescribed to manage acute manic episodes or as maintenance treatment. Some newer antipsychotics have mood stabilizing properties and can be effective in treating both manic and depressive symptoms. Antidepressants are sometimes used to treat bipolar depression, but their use is controversial. There's a risk that antidepressants could trigger a manic episode in some people with bipolar disorder. When prescribed, they're usually combined with a mood stabilizer. Psychotherapy, also known as talk therapy, is an essential component of treatment for bipolar disorder. Cognitive behavioral therapy, CBT, is one of the most widely used forms of psychotherapy for bipolar disorder, helping individuals to identify and change negative thought patterns and behaviors that contribute to mood episodes. Lifestyle changes can significantly impact the course of bipolar disorder. Regular sleep patterns are particularly important, as sleep disturbances can trigger mood episodes. Regular exercise has been shown to have mood stabilizing effects and can help manage the weight gain often associated with some bipolar medications. A balanced diet and limiting alcohol and caffeine intake can also contribute to mood stability. Now, we want to hear from you. Do you or someone you know have bipolar disorder? What strategies or treatments have made the biggest difference in your journey? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.